Welcome to our first topic in a series of 6 sessions provided by Berkshire Healthcare Trust, and in particular welcome to our Understanding Dementia course. My name is Jackie Huzzy. I'm one of the consultants in old age psychiatry, and I've been involved working in the field of dementia for nearly 20 years now. So what is dementia? Dementia is a term that we use to describe actually a group of conditions which can affect memory. People may find it harder to remember things or develop other problems with their thinking. This makes it more difficult for them to cope with their daily life. And in dementia, we know that these problems get worse or they progress. They're not just down to normal aging. There are in fact many different types of dementia. Commonly, someone with dementia starts with difficulty in remembering things, but they can also struggle with other aspects of day-to-day life. They may have more difficulty with day-to-day tasks such as working the washing machine or the TV remote control, or find things like shaving more difficult. Communication with others may become more difficult in terms of trying to find the right words or to understand what others are saying. They may experience changes in their mood, perhaps seeming depressed or withdrawn or more irritable. As a friend or relative, you may notice changes in their personality, perhaps becoming more demonstrative or more disinhibited. And because dementia is progressive, someone with dementia will become more dependent upon others over time. So how common is dementia? We know that in the UK there are more than 850,000 people with dementia, and age is by far the commonest risk factor. So as we get older, our risk of dementia increases. At the age of 65, there will be about 2 in every 100 people that will have dementia. By the age of 85, this number changes so that about 1 person in every 5 will have some degree of dementia. And it's really important to remember that dementia can sometimes affect younger people, and it can run in families, although this is a lot less common. So out of the 850,000 people in the UK with dementia, it's estimated that 42,000 or just over will have dementia under the age of 65. So how do we work out if it's dementia or normal aging? Studies have looked at how cognition changes with age. So there is a normal level of cognitive decline associated with normal aging. And when we talk about cognition, we are talking about not just how the memory is affected, but really cognition is to do with how the brain processes information, not just memory, but also language and how the brain interprets what it sees as examples. So cognitive abilities peak, interestingly, at different ages. So our processing speeds are optimal around the age of 19. In our late 20s, our short-term memories are working at their best, and emotional intelligence or understanding emotional states peaks in our 40s and 50s. So dementia may be diagnosed if a person performs below the normal range for their age on a number of cognitive tests. Because dementia is so common, many of us will have had some experience of dementia. The Alzheimer Society estimate that 38% of the population know a family member or friend who has got dementia. But if you've met one person with dementia, you've met one person with dementia. The effect of disease on any individual varies, and it's the same with dementia. We will all possibly base our knowledge of what dementia is like on how the person we know who has dementia has been affected. So try to remember that the person you are caring for is not the same as someone else's relative or friend, and that their dementia may develop in a completely different way. Are people thinking differently about dementia? Today, dementia is usually diagnosed much earlier, and we can offer successful interventions to support people with dementia and their families, and sometimes actual medication to slow the decline. However, dementia often means having to make some lifestyle changes, and many people need to make adaptations as the dementia progresses. But having said that, many people live well with dementia. We think that this London Underground map is quite a good way to explain what is happening in the brain when someone has dementia. The brain is made up of millions of neurons or nerve cells. These are represented here as the tube stations. The nerve cells in the brain are all connected together by long white fibres, a bit like the tube rail network in the London Underground. In dementia, the number of brain cells and connections start to die off, so less information gets transferred in the brain. If you think of this example, if you wanted to get from Paddington to, let's say, South Kensington, the quickest route would be to go on the yellow circle or green district line. But if there's a problem with the connection and the circle or district lines are not working, you can still get to South Kensington taking the pink Hammersmith and City line, taking the link out of London down to Hammersmith and back into London. However, it will take much longer. And this is what tends to happen early in dementia. Processing might take a bit longer than it had previously. As time goes by, or sometimes still earlier in the illness, a pathway gets blocked off and there are no alternative routes. So here's an example. If you wanted to get from Paddington all the way down to, let's say, Putney Bridge on the district line, if this rail is blocked, there is no easy way to get to Putney Bridge at all. Similarly, in the brain, the information simply is not passed between nerve cells. We're now going to take you to a video which explains a little bit more about how the brain works. So to recap, there are different areas of the brain that have different functions. The frontal lobes in the main are involved in decision making, planning and problem solving. It's the area involved in initiation of thoughts and tasks. It is also the area of our brain linked with personality. The parietal lobes are the areas of the brain where we manage sensory information and movement. So they are to do with how we walk or raise an arm. The occipital lobes at the back of the brain are where we process the information which our eyes see. And the temporal lobes are involved in memory and language. They are also the areas where we process auditory information, i.e. what we hear. So people often ask, what is the difference between dementia and Alzheimer's disease? This is probably the question I get asked most in clinic. To explain this, think of dementia as the umbrella term, and there are many different types. Alzheimer's is the commonest form of dementia and accounts for 62% of all dementias in people over the age of 65. After that, there is vascular dementia, and then what we call a mixed dementia, where people have both features and pathology associated with Alzheimer's disease and vascular dementia. And as you can see, there are other rarer forms such as dementia with Lewy bodies, which has an overlap with Parkinson's disease dementia, and frontotemporal dementia. Are there ways to detect dementia early? What are the warning signs? Well, an international consensus has come up with 10 common symptoms. So memory loss we've touched upon. People can also have difficulty performing familiar tasks, so they don't keep up so well with some of their normal routines or cooking, for instance. They may have problems with language, and that's not just verbal language. They may also struggle more to write or even to read. They can become disorientated to time, so not knowing the date, not being quite sure which day of the week it is. Or they may struggle with new surroundings or even ones that should be or are expected to be familiar to them. So a common example is going to visit a son or daughter and staying with them, and they might have visited many times but will struggle more with where the kitchen is, for instance. They may develop poor judgment, and this could become apparent if they're still working or in dealing with financial matters. They often have problems keeping track of times, so they may start to miss appointments, for instance. They may misplace things around the house, losing their purse or wallet. They may have changes in mood and behaviour, so anxiety and depression are commonly associated with dementia. They may have some visual spatial difficulties, so parking the car may be the first thing that they struggle with. And they may become more withdrawn from their social circles. So to diagnose dementia, there must actually be a minimum of 2 of the following: memory problems, impairment of judgment and reasoning, and the ability to manage more complex tasks such as finances or appreciation of risk, impaired visual spatial function, impaired language abilities, and personality change. And even if people have 2 or more of those symptoms, we would only make a diagnosis if those actual symptoms have led to a change in someone's ability to function with their normal routines. So we're looking for a change in ability from whatever is the normal baseline for that person. We also need to rule out other things such as people having physical illness or infection that could lead to confusion, because their cognitive symptoms can improve once the underlying illness has been treated. And it's also really important not to miss psychiatric illnesses such as depression, which can sometimes mimic dementia. We call it, in fact, a pseudo-dementia. And clearly, depression can be treated and any associated cognitive symptoms would be expected to recover as the depression lifts. So who is at risk from dementia? We know that advancing age is a risk factor, but dementia is not an inevitable consequence of aging. Certain other illnesses or medical conditions can make dementia more likely. So Parkinson's disease, this is a condition which originally was thought to just affect movement, but we know now that people can have cognitive impairment in association with it. If someone has strokes or heart disease, then they are more at risk of dementia too. And this seems to be linked to the narrowing of blood vessels and the formation of clots. High blood pressure and high cholesterol are more associated with strokes and heart disease, and therefore are also risk factors for dementia. And then there's type 2 diabetes. That's the diabetes that tends to come on in midlife, which is another important risk factor. So the thing with risk factors is that it's important to try and address them. So in certainly midlife years, it's important to try and manage any hearing loss that people have, obesity, social isolation and depression. But it's particularly important to try and manage things such as the high blood pressure and diabetes. So there are also lifestyle factors that can increase the risk of dementia. So these are things such as smoking, drinking above safe limits of alcohol. The current government recommendation is no more than 14 units per week. And as a reminder, 1 unit of alcohol is a half a pint of a normal strength beer, so something around 3.5%, 1 pub measure of a spirit, or 1 small glass of wine. Not taking enough exercise, becoming overweight, having a poor diet are also risk factors for dementia. And we're also finding out that people that have had repeated head injuries, so for instance boxers, quite possibly the footballers that used to head the old leather ball, are more at risk. So what can be done about it? Well, the World Health Organization recommends the following, which seem quite obvious, but perhaps harder for people to do. So stopping smoking, reduce alcohol intake, take regular exercise, and eat a healthy, balanced diet. And the mantra now is what's good for the heart is good for the brain. So the recommendation is a Mediterranean diet, so a diet that's rich in sort of grains and pulses, vegetables, fruit, oily fish. And it's thought that this can actually reduce the risk of dementia. The important time really to make the changes are in one's 40s and 50s. So is dementia inherited? Yes, dementia can be inherited, but it usually isn't. Most people who get dementia might not have a family history. And there's a big difference between inheriting a gene which may slightly increase your chance of getting dementia, which can happen, and inheriting a gene which will definitely cause dementia. And this is particularly rare. This is an example of a risk gene. So in Alzheimer's disease, there is an identified gene called apolipoprotein E. And there are different variants of it, and it's the apolipoprotein E4, which is the one that we're interested in. We abbreviate it to ApoE4. Now we inherit genes from both parents, so we get 1 copy from our mother and 1 copy from our father. So if someone inherits a copy of the ApoE4 from 1 parent only, and that's around 1 in 4 people, then they are 3 times more likely to develop Alzheimer's disease. If you inherit 2 copies, so 1 from your mother and from your father, and that's around 1 in 50 people, then those people are 10 times more likely to get Alzheimer's disease. However, there are many people with 2 copies or 1 copy of the ApoE4 who never develop Alzheimer's. So this is what we mean by a risk gene. There are genes that are involved in much rarer forms of dementia, and research in this area is growing all the time. There is a rare form of young onset dementia called familial Alzheimer's disease, which can be passed on. This is very, very rare, and what we know now is that there are 3 different genes implicated. These are called presenilin 1, presenilin 2, and amyloid precursor protein. And it's important to remember that with other forms of dementia, for which there is perhaps less talk about, more research is happening. So we've now learnt that certain forms of frontotemporal dementia, particularly one that has the kind of behavioural variation, has a strong genetic link. The overall message, however, is try not to worry if someone in your family has dementia. Even if there is a family link, it's much more likely that you have inherited a risk gene rather than one which will definitely cause dementia. We're going to take a break now for questions and further discussion.